Hello, everyone. Welcome to Faculty Spotlights for the College of Professional Psychology at the Chicago School. I am Lance Garrison, Dean of the college, and we are joined today by Dr. Janina Kamm, faculty member for our clinical psychology program in Chicago. Welcome, Dr. Kamm.
Thank you.
Dr. Kamm, can you share a little bit about your background and how you ended up being a faculty member at the Chicago School?
Sure. I don't know if you know this, Dean Garrison. I am an alum from the program.
Oh, wonderful.
And yeah, I joined the program. I was pretty sure that I wanted to do trauma therapy. That's what I was pretty sure I would do. And I fell in love with neuropsychology while I was in the program. And so very quickly I pivoted and I thought some training experiences that actually allowed me to do both. I did training through academic medical centers and local VA hospitals to get training in neuropsychology and trauma therapy. And then I tell this to students quite a bit because I think it's important to consider because sometimes we have students who come in and they think they know exactly what they're going to do at the end of the
Yeah.
4 years. I decided neuro at 11:59 right before my match list was
Oh,
due,
wow.
internship. So I had actually even applied to different tracks at different sites. Is still not quite sure. It was definitely the right decision. I went on to complete an internship in clinical neuropsychology at the Dallas VA. So I worked with
Oh,
veterans there. I think I fell in love with academics at the Chicago School, and then I fell in love with working with patients through VA hospitals. I really liked the work that I got to do with veterans.
yeah.
And then from there, I went to a 2-year fellowship at the University of Iowa. I got to train in an academic medical center, and I fell in love with patients at the VA, and I think I fell in love with research at
Yeah.
Iowa. So from Iowa, I had the privilege of participating in leading actually in neuroimaging studies. I worked a lot with folks who had different types of disorders of development, either structurally in the brain or acquired. And we looked at ways that we might be able to predict outcomes if they had surgical treatment to help alleviate some of their symptoms related to these
Hmm.
developmental or acquired changes in the brain. And then I worked in clinic and I got to do a whole range of different types of neuropsychological evaluations across a lifespan. I got to work with, the very young and the very old. And after I'd finished my fellowship, I was very privileged to be invited to join. So I stayed on as an attending in Iowa, and I did that for a little over a year, and I wanted to move back home.
Yeah.
So I'm from Illinois. And I moved back home and I joined a really large group neurology practice, and I liked that work quite a bit. But it didn't scratch the itch of teaching. And I even when I was at Iowa, I got some teaching exposure there too. And I thought, oh, I'll do something like I'll adjunct or try to find a place where I might be able to pick up a class. And so I checked back in with the program that I had such a good experience with, and the chair at the time had said that they were actually seeking a clinical neuropsychologist. So
Perfect timing.
that's yeah, it was perfect timing. So that's sort of how I wound up here.
Yeah. You said something really interesting that in my conversations with other faculty has come up, and that's that, oftentimes when students come into a program, they have kind of a narrowed focus of what they believe they want to do at the end of their degree. But when you get in and begin to experience kind of the full breadth of the curriculum and you get exposed to these, different areas of specialization within the field, that can shift quite,
Oh
and
yeah.
quite often it does.
hmm
Yeah.
Yeah, I mean, I chose this ID program because I really like especially this program in particular, it's in a major metro hub. So
Yeah.
I have a lot of different opportunities to train in different settings. So I thought that would be really nice in terms of breadth of therapeutic training. Um, and 10 years later, I ended up in a situation where a lot of my job was research oriented. So I really didn't, in thinking about, where I wanted to end up career-wise, I didn't anticipate any of that. Um, so yeah, I think it's a good idea to have a sense of what you're wanting to do, and then
Sure.
keep an open mind, like what seems to really click for you, what gets you really excited when you're
Yeah.
training.
Yeah. So, what areas of teaching? I know you mentioned neuropsych, but are there some areas of teaching or research or your clinical practice that you're particularly passionate about these days?
These days, my research looks quite a bit different. It's especially the PsyD model. We're going to foster their own unique research interests. So I
Yeah.
pretty much lean into working with my students on research areas that they're very excited about. I really like the ability to do that. Actually,
Yeah.
it's really nice. There's some. It has to be within reason. It has to be under my area of expertise, but
Yeah.
I previously probably wouldn't be doing a ton of research on the impact of socioeconomic status on screen time outcomes in children. That is so interesting to me, and I've got a
Yeah.
student who really wants to look at sort of the nuance. We know that we know for sure that a lot of screen time is a bad idea, but
Right.
there's a big stretch of information that we don't really have a handle on between like no screen time ever and lots of screen time. And one of my students is looking into, are there differences in how we approach screen time? How is there a difference in your income as a family and how you use your screen time?
Yeah.
And does that make a difference in terms of outcomes or negative effects of screen time? It's such an interesting topic to me because I even think about like so at Iowa, it's an integrated program. I work a lot with med students. They're on the screen at all times. They're always
Right.
staring at the
They
screen.
live on the screen.
Yeah, certainly we don't see all these, higher incidents of behavioral disruption related to,
Yeah.
studying at med school. So it's such a fascinating way to examine that problem.
Yeah.
And it's totally student driven. It's just one of my brilliant students really wants to look into this. So lately, my area of research is guided by student interest. And I
Yeah.
really like doing that kind of work. For my, teaching interests, it's all neuro. So
Yeah.
and as you know, our program, we're setting up a major area of study in neuropsychology. It's really important to us as a faculty that we follow best practice for offering these types of programs. So our program is informed by the Houston Conference model of
Hmm.
training for competency. It follows APA's taxonomy for specialty training and soon to be the Minnesota conferences will get those finalized and out. Actually, probably are just now published. And so a lot of what I'm teaching right now is to try and ensure that our students are getting both a really robust and well-rounded curriculum while
Hmm.
having those opportunities for specialty interests like neuropsychology.
Yeah, I think that's a really exciting development for the program there in Chicago, is that neuropsych track. I can't wait to see what comes of that.
Yeah, and our students are doing great.
Yeah.
They're consistently matching to their picks for neuropsychology, and it's really me. I'm early career, as you know, so I've just had my first couple cohorts off to fellowship
Yeah.
now. So I'm starting to see peers matriculate, and that's really nice. It's
That's
exciting
very
to
cool.
see. Hmm.
Now, and you just touched on this, but think about a little bit about the work that you do, and can you tell me how you feel like that impacts students and maybe even the broader community?
When I think about the work of a neuropsychologist, I'll start there. I think some of the work I do, especially with our students, is try to get them to speak in plain language, like easy
Yeah.
to understand words. I feel like by the time we get to graduate school, you've gotten so many cookies for like the bigger the word, the harder it is to say,
Yeah.
the better the writing. And neuropsychologists, a really unique aspect of our practice is like the simpler, the better. Like
Yeah.
everyone in the room should understand what it is you're trying to say because you're trying to communicate a summary of a
Yeah.
situation in a way that everyone's on the same page. So, an aspect that I hope that I contribute to professional practice is helping future clinicians access language that people get, like they
Yeah.
understand what it means. We talk a lot about even recommendations that we might make to patients. I think a lot when I'm in my own primary care doctor appointments and they say things like, "Oh, how are you feeling lately?" It's like, "Oh, I'm feeling fine. Are you exercising?" "Yeah, pretty much." Those types of superficial questions, right? That makes sense. You're screening in a primary care
Sure.
doctor. office. That's a good idea. You want to hear for any extremes and know if referrals need to be made. For psychologists, that kind of stuff, that's not enough. And the
No.
recommendations aren't enough. Like, oh, you need to go work out. Okay, how? So we'll
Yeah.
talk about how do you talk with patients even I always have like I talk a lot about it's always like close to the time of year where people are selling the equipment they bought for their New Year's resolution for like
Yeah.
half the amount of money on Facebook Marketplace. I will talk with patients about, okay, so like what is realistic for you to
Yeah.
get exercise in your life? That's to me, when I think about what we do in assessment, to me, that's much more meaningful. Like, how can you execute something that is going to meaningfully impact with
Yeah.
exercise, right? It's going to help with cognition and it's going to help
Yeah.
with mood. But it's hard. If it was easy to exercise, we'd all be doing it every day because it helps with everything. It's just hard to do. So I like to think about our work as assessment providers as really identifying those types of things. You get for
Yeah.
neuropsychology specifically, you get like 30 minutes, 40 minutes to really talk through patients, what are your findings mean
Hmm.
for the work that, I hope that I'm contributing to the field. I don't want my students spending 40 minutes talking about statistics, right? Your score
Right.
falls in this range. Instead, we could be talking about like what are some barriers that are keeping you from being able to take your medications on time and
Yeah.
prescribed, which happens all the time to almost everybody, right? With it,
Yeah.
it can be tricky. So like, can we come up with a system that actually works for you? What are some barriers for exercise? What are some things that are keeping you out of therapy? Therapy you've got a really wide range of reactions to therapy. Some people have had really bad past experiences with
Yeah.
therapy. So addressing that directly with patients, like talking about what therapy can look like, how it can be helpful, what their experiences even are, if they're wanting it, and those types of practice approaches,
Yeah.
I hope, is something that I'm contributing in terms of where we head with our future clinicians. We
Yeah.
talk a lot too in my, general classes about the biology and the physiology that underlies some of, just common practice approaches. So sometimes I'll see things, day to day, like therapists on social media saying, oh, you've got to take this supplement. This supplement will cure your ADHD. They've cured all my patients' ADHD. So we'll, in our general neuro classes, we'll talk a little bit about like, let's go find out if that supplement can reach the target organ. Let's see if that can get to the brain.
Yeah.
And a lot of time, I mean, what's really fascinating, a lot of times we do this, look into these things and we can't even figure out what's in that supplement that's being
Right.
sold for $40 to people who are often on fixed income. So th those aspects of practice too, I hope, not just for people who want to go into neuropsychology, but like thinking thoughtfully about how to integrate high yield recommendations in your
Yeah.
therapeutic work too.
Yeah. A couple aspects of what you said I really love. The idea of speaking in accessible language is
Hmm.
so important because I think as psychologists and students who are going through a program, you're so immersed in the technical language of the field that you forget that you're this small select group of individuals who get that level of immersion, and
Hmm.
the majority of the public has no clue what you're saying if
Hmm.
you speak that language. So making it accessible is so critical. And the other thing you said that I really love is about, and correct me if I'm wrong, but it's kind of like outcomes driven assessment, right? You're looking for how can this assessment yield information that leads to some tangible improvements or benefits for the person being assessed. And I think oftentimes we think about assessment as a diagnostic process,
Yeah.
right? We're trying to
And you get a
arrive at a
label at the end.
diagnosis. Yeah. And that's true, right? But there's so much more that can be done with that data, with that information that is involved and collected during the assessment process. So the idea of saying, okay, well, how can I use this document and this process to give some really tangible, concrete, meaningful recommendations to improve the person's life for the time that they've given to be a part of this process? I think it's fantastic.
And it's not a very fun process. That's the other thing we talk about.
No, no.
No, you do. You want there to be an effective recommendation session at the end
Yeah,
because it's not fun.
absolutely. So, being a graduate of the program and now, being a faculty member in the program, what do you think it is about the PsyD program there in Chicago that makes it especially valuable or unique for students?
Yeah, I love this, this question. I like talking with applicants about it. There is a lot that makes it uniquely suited to
Hmm.
train PsyD students. It's in a major metro area. So, and I say that this is true of any PsyD program in this area. You have access to some of the best training sites with really broad and specific niche specialty
Yeah,
populations. So it gives you an opportunity to see a really wide range of assessment and therapeutic needs, which is pretty exceptional. That's
yeah.
very hard to get. So when I think about, even when I was considering programs, obviously there's a theme here that I really like to be by my home. I like my family. I like to stay put. But even when I think about, applying more broadly for someone like me who thought, I know I want to do therapeutic, so I want a
Mhm.
model that emphasizes therapeutic training, but I'm not quite sure what other than that. Being embedded in a city where there's lots of access to different intervention training is
Yeah,
really nice because you get lots of different supervisory styles and exposures. It really helps you identify what you like and what you maybe is not a good fit for you. So that piece is really important. But the other piece that I don't know, I knew it wasn't intentional when I picked the program, but certainly I am very grateful for now, is that you're in a large cohort. You're in a large cohort, and this program, and this is one of the reasons I like teaching for the program, it takes non-trad students. So you're not dealing with students that have the fortune. Like when I was applying to school, I also had several parents and loved ones, like relatives with
hmm,
advanced degrees, who could talk to me about that process. The typical Chicago school student does not have an immediate
yeah,
relative with an advanced degree while they're navigating the process, which also means that they have a diversity of perspective that you don't always encounter in academics. So the other nice thing about a larger cohort where you have lots of non-trad students mixed in with some traditional, traditional candidates, is that you have a wider range of experiences and perspectives. And so
yeah,
something that I still value, like now as faculty in this program, I still talk to many of my peers from my cohort at the Chicago School. They all have different areas of practice approach. One of them is adjunct now, actually, in our master's
yeah,
program, but I think of her often because I very much was embedded in the medical model of training, and I see a lot of my approach as being aligned with a medical model of training. And she would be happy to burn the whole thing down. I mean, she's like an abolitionist. She she is just everything that's great about art of therapy. And when I have questions, like when there is something new or different about the field or language that we're using to characterize phenomenon, I ask her because she always knows. Like she always knows this new sociological thing. And she was a peer in my cohort that I just liked. I got to know when
yeah,
she was a friend. We had nothing else in common. We don't share an area of focus, an area of study. There is no other version of training where we're interacting with one another all that often.
yeah,
So that piece didn't really register when I was in
yeah,
the program, but now, as a licensed clinician, thinking about who do I talk to with this, I have many different someones just available to me. So that piece, I think, is really important too. So those are some reasons I really like this question about what
yeah.
some of the really unique and important strengths of the Chicago School is. It has a lot to do with well-roundedness, exposure to different ideas and perspectives in the field. I think it's a large strength of the program.
Yeah, that diversity of background, experience, and perspective that you get in a larger cohort, I think is pretty important to your point to help create a more well-rounded training experience and a group of colleagues that you can call on for many years to come.
Mhm.
So kind of staying on students, What advice would you give to a prospective student who's trying to figure out, is clinical psychology right for me? Is a PsyD versus a PhD? What choice should I make? What advice would you give that student?
So I'll stick to neuro because that's usually kind
Okay.
of those are the emails I get from prospective students. So I'll try to answer some of those kind of specific questions. As far as PsyD versus PhD, I think the important thing you need to be checking on is you want to look at program fit. If
Hmm.
you do have an understanding for neuropsychology, if you have an understanding of your goals, my advice, my opinion is that you need to be at a program where they have a boarded or board eligible clinical neuropsychologist. Something that's very important for
Yeah.
neuropsychology specifically is guided mentorship from someone who has practice experience and has those connections. That's an important piece of subspecialty work. As far as, the ins and outs of how much emphasis you want to place on practice versus research, in working in both, as faculty in a PhD program, we worked a lot with PhD students, and now working with exclusively PsyD students. I will say strong students are strong students, and the better um, kind of or where I think students should really focus funnel their efforts when they're trying to vet is like what are you actually really interested in?
Yeah.
If you're interested in neuropsychology, you're not getting out of it without research. So if you're someone who goes, I hate research, not for me, probably not neuropsychology,
Neuropsych probably not your best route.
probably not your fit, and that's okay. But as far as degree of emphasis you want to place on it, that can be variable, but you need to have the opportunity to do
Mhm.
research with the program with an invested mentor, and that's where fit is really important. So like actually, I know it can feel really intimidating when you're applying to places and you're meeting with faculty, but it's a two-way thing. If you're
Yeah.
talking with them and you feel like I didn't get a good vibe, but I really want to get in, that's
Yeah.
probably not going to be a place where you really grow and develop because you need to be able to feel like you can trust everyone around you. You can be a bit vulnerable for the type of
Yeah.
work we do. And then especially like I'm speaking to the students who kind of come in knowing I want to do neuropsychology and nothing else, especially for them. The best clinical neuropsychologists are good psychologists. You
Yeah.
have to have well-rounded training.
Yeah.
And I think that's very hard to appreciate at the earliest stages because you sort of see the thing you want at the end. But having good intervention skills is what can make you an actual useful, helpful clinical neuropsychologist. Because as we were just talking about, the
Yeah.
diagnosis piece, though it seems very important, the actual thing that we call it is a lot less important than what are we going to do? What do you
Yeah.
need? Those skills come from therapeutic training, intervention training.
Yeah.
The other stuff is what you have to learn in order to be able to execute the therapeutic training. So I think really trying to master, especially your foundational learning, and being open-minded when you start the program that maybe your interests totally change and they shift over time, and that's okay. Um,
Absolutely.
yeah,
Well, Dr. Kamm, I've really enjoyed our conversation. Thank you for joining us.
yeah. Thanks for having me.